CAR T cells, like I said, exciting. Patients have it on their minds all the time. This is the first time where we have been able to really engage our immune system and use our immune system against the cancer, which to me is extremely powerful. And what to me is most exciting is, when we first started CAR T cells, we're doing it kind of end-stage myeloma. And all of us know myeloma is a disease of the immune system. So end-stage myeloma, your immune system is not that robust, and yet we have been able to generate CARs which have given us amazing response rates. I think the challenge now is how do you make this response last longer, and we talked about different methods. As far as patients are concerned, patients are quite afraid of going for CAR T cells, and we can appreciate that. But over time, as we're using more and more of these technologies, we are getting better at managing the toxicities. And some of the products we have, especially BB2121, I've been pleasantly surprised that it's been generally well tolerated. You do get cytokine release syndrome, and what that really means is when you give activated T cells and when they go look for your tumor and kill your tumor, you produce certain cytokines from your tumor, and those cytokines can make you sick. Now we've started recognizing that. We have drugs that we can use against that, and that's why we've been able to manage it quite well. So CRS is common. We sometimes, in a weird kind of a way, like to see a little bit of CRS because it tells us that your T cells are actually fighting. And the other big toxicity that we worry about in the CAR T cell space is neurotoxicity, because CARs can actually go and cross the blood-brain barrier, which is a good and a bad thing, because for CNS myeloma we have no treatments at all. But while doing so, it can really irritate the brain, and that's again something where we have to be able to pick up that and treat that. But in general, patients will confuse CAR T cells a lot with a transplant, and it's not a transplant. It's not mega doses of chemotherapy that we're giving you low doses, but because of this unpredictable issues around CRS and neurotoxicity, we do watch you and we see you in the hospital. As we get more comfortable, we are talking about trying to do this even as an outpatient. And the other beauty of this, at least as of right now, is we give the CAR T cells, and if you've had a response, you're on no treatment for your myeloma. And that, I think, is a first in myeloma. We've never not given patients sort of maintenance treatments. So, I would urge people who are interested to learn more, read more, look at more webinars, and reach out to some of the experts close to them to get a sense of the CARs, because there is a lot of misinformation out there.